Hi everyone, my name is Juliana Guerrero and my partners and I will educate you on sexual health. Our main focus is to educate adolescents and people who are planning to begin engaging in sexual activity for the first time, as well as teach uneducated people about the consequences of being uninformed about sex and sexual health.
Hello, my name is Luke Bagley, and this is our presentation on sexual health. Today I will be going over the topics of safe sex and STDs.
Hi, I'm Diana Padilla, and the concepts of sexual health that I'm going to be going over are reproduction and orientation.
What is sexual health? Sexual health is a part of an individual's overall health. It is as important as physical, mental, social, cultural, environmental, and spiritual health. It is important that people maintain a balance with every aspect of health. It is often common that people do not really focus on sexual health as an aspect of life. Families are different, which explains why some people are comfortable talking about sex while others are not. Some countries and families do not educate children about this topic. However, this type of health involves consideration when planning to become sexually active no matter what age. It is important that people are educated on the subject to stay protected and prevent consequences. Sexual health is not just about sex. It involves communication with partners and individuals' well-being. According to the World Health Organization, sexual health requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences, free of coercion, discrimination, and violence. Concepts of sexual health include consent, contraception, safe sex, STDs, reproduction, and orientation. Discovering sexual health. Sexual health is all about learning about one's sexual preference, which also includes self-pleasure, aka masturbation, which offers many health benefits. Getting to know your body can help maintain intimacy in a relationship and also develop and improve communication between partners. According to Ashley Robinson, taking time out of your day to engage in solo sexual pleasure actually has health benefits such as alleviating stress, improving sleep, and relieving menstrual cramps. Let's start with the concept of consent. What is consent? According to the Rape, Abuse, and Incest National Network, consent is an agreement between participants who engage in sexual activity. Consent should be clearly and freely communicated. A verbal and affirmative expression of consent can help both you and your partner to understand and respect each other's boundaries. It cannot be given by underage, intoxicated, or unconscious people. Important things to know about consent. Consent is all about communication. It is important to discuss boundaries with your sexual partner. You can also change your mind at any time because no means no. People who plan to become sexually active should understand that it is okay to say no, no matter how far things have progressed. Consent should be given every time something happens. It is important that people do not make assumptions or force someone to finish what they started.
Sexual consent means that both people are actively willing to engage in a particular sexual behavior and express their consent by saying, yes, that's okay with me. But just because someone consents to engage in one kind of behavior does not mean that they have agreed to engage in another. Anyone has the right to change their mind about what they do or do not want to do at any time. This means that even if you are engaging in sexual acts with a person and they change their mind, you must stop and respect that person's wishes. Just because someone doesn't say no, it doesn't mean that they have said yes or given their consent. If a person is under the influence of drugs or alcohol, they are legally not able to give consent. Engaging in sexual behavior with someone who does not or cannot consent is sexual assault or rape. If you have been raped or sexually assaulted, please note that it is never your fault. It is also important to talk to a trusted adult about what has happened.
This video can be used to teach young people about consent using examples. What is sexual assault? Unfortunately, many males and females continue to suffer from sexual assault. Most common places where sexual assault happens include schools, workplaces, college parties, public spaces. Sexual assault is defined as unconsented sexual contact or behavior of a victim. Forms of SA include attempted rape, fondling or unwanted sexual touching, forcing a victim to perform sexual acts, and rape, which is the sexual penetration without consent. People who suffer from sexual assault are not at fault. Help is available at National Sexual Assault Hotline, which can be called in the number on the slide. Counseling is available for SA victims who choose to talk about their experience and can help them heal from this. Learning about sexual harassment can help adolescents or people who plan to engage in sexual activities for the first time to know about the dangers and protect themselves. Now let's talk about contraception. There are many contraception methods that people can use to prevent things like unintended pregnancy, STDs, and HIV. Some methods include condoms, which are not available for both males and females, birth control pills, birth control implants, IUDs, birth control injections, and permanent surgical procedures for both males and females. Consequences of people who have unprotected sex include unintended pregnancies, STDs, and HIV transmission. Important statistics. For unintended pregnancy, according to the WHO, as of 2019, adolescents aged 15 to 19 years in low and middle income countries had an estimated 21 million pregnancies each year, of which approximately 50% were unintended and which resulted in an estimated 12 million births. In regards to STDs and STIs, the WHO states more than 1 million sexually transmitted infections are acquired every day worldwide, the majority of which are asymptomatic. For HIV transmission, the WHO states, HIV remains a major global public health issue, having claimed 40.4 million lives so far, with ongoing transmission in all countries globally, with some countries reporting increasing trends in new infections when previously on the decline. Checklist for good sexual health. It is important to keep in mind that education about sexual health can teach young students about sex, consequences, and prevention. Consent is important in every sexual relationship. Yes means yes and no means no. People who are sexually active should have regular checkups done to stay healthy and catch STDs on time if transmission occurred. Prevention using contraception is important to prevent any disease and unintended pregnancies. Sexual health services and resources. Many schools offer sexual health services such as education, free contraceptive services, and counseling. The Planned Parenthood is a research that has clinics and it offers many sexual health services such as STDs and pregnancy testing. Also, primary care and contraceptive services. Local clinics can be found online and most offer sexual health resources.
Hello, my name is Luke Bagley, and for my part of the presentation, I will be talking about safe sex. Having safe sex helps you protect against unwanted pregnancies and STDs. There are many products made to help you have sex safely. In the following slides, we will go over some of your best options to have safe sex. Many products are made to help people have sex safely. One of the most popular items is condoms. Condoms are readily available and accessible for most people, found in most convenience stores. Condoms are one of the best and most commonly used ways to have safe sex. They're a thin, stretchy pouch worn on the penis that prevents skin contact and also catches sperm before it is able to impregnate a woman. It helps protect against STDs by stopping skin contact and helps protect against pregnancy by catching on the sperm. They are commonly found and easily accessible and 87% effective, as shown by Planned Parenthood. The next commonly used birth control method is the birth control pill. Birth control pills are taken by the woman every day and changes their hormones to stop the sperm from joining with the egg. It also stops the egg from being released at all. Birth control pills are cheap and moderately accessible to most girls, unless they are very young. It stops ovulation, but a downside of birth control pills is it does not protect against STDs because there's no stopping skin-to-skin contact. It only protects against actually becoming pregnant. Birth control pills are rated 93% effective and a very good option if you don't have a lot of money to spend and you want something that's not super permanent. The next option is highly recommended by doctors. It is a small device placed inside the uterus called an IUD. It is long-term and reliable. It can last from 3 to 12 years depending on which IUD you get and which company makes it. There are two different types of IUDs, the copper IUD and the hormonal IUD. Both do the same thing, but they just work in slightly different ways. It has one of the highest success rates of a 99% success rate, which makes it one of the most reliable birth control options. But if you don't know it when you would like to actually become pregnant, it can be a bad option because it is very permanent and you need another procedure to take it out. They change the way sperm cells move so that they cannot enter the egg and fertilize it. They can also be used as an emergency contraceptive instead of Plan B. They are 99% effective if put in from 1 to 5 days after unprotected sex was had. The next birth control option is the birth control implant. It is very similar to the IUD in that it is implanted and lasts for 5 years, while the IUD lasts for anywhere from 3 to 12 years. The birth control implant lasts for 5. It works similarly as the hormonal IUD by changing the hormones of the body to stop the ability of fertilization. It is also 99% effective, but it cannot be used as an emergency contraceptive. It also does not protect against STDs, but it's less painful as it is inserted into the upper arm. So if you want something in the middle of an IUD, but you don't like it being inserted in your uterus, this is also another very good option. The last option we will be going over is the birth control shot. It is a shot that has to be taken once every 3 months on time, and if taken on time prevents ovulation, which stops the egg from exiting the ovaries and going into the uterus. It does not protect against STDs as there is no stopping of skin-to-skin contact, and if done on time, has a 99% chance of stopping fertilization. As you can see, there's many good options for birth control. However, none of them are perfect, and none of them do everything. As for example, the condoms are only 87% effective, but are the only ones that prevent STDs, along with other types of skin barriers, like condoms for women. So, it is best to use these options in pairing with one another, like using a women's birth control option, like the pills, IUD, implant, or shot, coupled with the man using a condom. for the most effective result and the most safe sex experience. Now that we have gone over how to have safe sex, let's see what kind of STDs you can get if you don't. This is why it is extremely important to use condoms, because in the following list, we're going to be showing and taking a deeper look into lots of different types of STDs that you do not want to get, and some of them cannot be cured. What are STDs? STDs are an infection, disease, or virus that spreads from one person to another, usually during oral, vaginal, or anal sex. STDs are very common, and lots of them don't even have symptoms, so you will not know that you have them until you get tested, or until they escalate and become worse, or uncurable. Most of them are easy to treat and can be treated with simple antibiotics, but some are not. Some of them can lead to very serious health issues if not treated and taken care of. So, we are going to be talking about some of those. But, on the good news, it is extremely easy to be tested for STDs. Most of them can be done with a simple urine test at your regular checkup appointment with your doctor, but some of them do require a blood test. But most insurances will cover this, so it is easy to get tested. The first STD we'll be talking about is herpes. It is one of the most common STDs around. It is a virus that causes sores on the mouth or genitals. There are two types of herpes, and having one does not mean that you have both. There are mouth herpes and there is genital herpes. More than half Americans have oral herpes, and about 1 in 6 people in America have genital herpes. Herpes is spread through skin-to-skin contact with the infected areas, although it usually only happens if sores are showing. But that is not in 100%. You can still get herpes from someone even if they are not showing that they have sores at the moment. There is no cure for herpes, but you can treat it with medicine and make it more difficult to transfer on to your partner. The second STD we'll be going over is chlamydia. Chlamydia is a very common bacterial infection. It is easily cured by antibiotic medicine, so you don't really have to worry too much if you are diagnosed with it. It is one of the less serious ones. Most people don't actually show any symptoms for chlamydia. It is transmitted by sexual contact through the semen, usually during oral or vaginal sex. It can also be transmitted through vaginal fluids, not just semen. Close to 3 million Americans get chlamydia every single year, and it can infect the penis, vagina, anus, cervix, and urethra. The next STD we're going to be talking about is gonorrhea. Gonorrhea is a lot like chlamydia. It is also a common bacterial infection, and it is also easily cured with antibiotic medicine. It is known as the clap or the drip, also in slang terms, because sometimes the fluid inside the penis gets very hard and you have to clap it to get it to break up and released, or else, which can be an extremely painful process. So definitely not something that you want to get, but it is curable. It's spread through vaginal, anal, and oral sex, just like the last one, and a lot of people don't actually have symptoms when they get it. But gonorrhea can lead to serious health problems if not cured early, which is why you want to consistently get tested if you are having sex with multiple people or new people. The last STD we will be going over is HIV or AIDS. HIV and AIDS are not the same thing, and HIV is actually the virus that causes AIDS. It damages your immune system, making it easier for you to get sick and making sicknesses more dangerous. About 1.1 million people in the U.S. are currently living with HIV. Sadly, for this one, there is no cure, which is why it is such a big name, and a lot of people are very worried about it. If you end up having AIDS, it is just going to make your whole immune system much weaker, and you are much more likely to die earlier in life. It shortens your life expectancy by a lot. Medicine can help you stay healthy and stop you from spreading it, or at least try to help you from spreading it. That is a recent discovery that people maybe made a lot of improvements to AIDS medicine. So if you find it early, usually you can take a lot of treatment and stop it from turning into AIDS. Without treatment, though, it usually takes about 10 years to develop AIDS from HIV, which is, again, why testing consistently is extremely important, because if you catch it before you have AIDS and start treatment, you have a lot better chances. So, after reading and listening to all the different STDs you can get, and that is not all of them, there are more, but there's too many to go over, so I just went over most of the common ones. But hopefully now you understand why you should consistently use protection to prevent STDs.
Now moving on to reproduction. Reproduction is the production of an offspring. In other words, meaning being pregnant. Some pregnancy symptoms include missing your period, nausea and vomiting, tender breasts, mood swings, fatigue, food aversions, spotting, raised temperature, increased urination, and the list goes on and on. Symptoms can vary from person to person. Some people have reported not having any symptoms at all and not even knowing they were pregnant. Pregnancy test methods. There are 3 main pregnancy test methods. The first one on here being a blood test, which can be taken as early as 11 to 14 days after ovulation. This is the most accurate test, although the results can take a couple of days. Moving on, we have a urine pregnancy test. This is the most accessible. You could get them at any drugstore, even a dollar store, and you get instant results, but it's the best to take this test after missing your period, as taking it too early can cause a false negative result. And lastly on here is an ultrasound. This is a safe and painless test that uses sound waves to show a picture of a baby on a screen. It's best to take this test after 6 weeks so that you can actually detect something. This statistic shows that 5% of reproductive aged women in the U.S. have unplanned pregnancies. So what are some options? So there's 3 main options, which are going through the pregnancy and raising the baby. The second option is still going through the pregnancy and giving the baby up for adoption. And the last option is terminating the pregnancy by having an abortion. And it is important to communicate with your partner and make the right decision for both of you, as this is a huge decision. So you guys really need to talk this out. Now moving on, let's talk about how having unprotected sex can also affect pregnancy. Getting checked and treated if necessary for an STI is crucial if you want to get pregnant, as some STIs can affect female and male fertility. Some STIs can even cause health problems for you and your baby. Untreated STDs or infections can move up the reproductive system and spread to the uterus, causing scarring or inflammation of the fallopian tubes, which can lead to infertility. Untreated gonorrhea in pregnancy has also been linked to miscarriages, premature birth, low birth weight, and premature rupture of membranes, which this is one of the many reasons why protection is extremely important. Now let's talk about orientation. Sexual orientation is a person's identity in relation to the gender that they're attracted to.
Every individual's sexual orientation is a bit different from the other, just like personalities and appearances are slightly different in each person. Different people are attracted romantically or sexually to various features and characteristics in others. Some people do not feel attraction at all and identify as asexual. A person's feelings about attraction can evolve or may stay the same over time. The same is true across cultures and countries all over the world.
Human sexuality is a huge spectrum. Right here we have heterosexual, which means attraction to the opposite gender. Bisexual is attraction to the opposite and same gender as themselves. Homosexual is attraction to one's own gender. Pansexual is the attraction to people of any gender identity. And asexual is not being sexually attracted to other people at all. Sexuality is diverse and personal. It's an important part of who you are, and it's okay to want to experiment, but remember to always use protection, do regular testing, and most important, stay in your comfort zone and don't be afraid to set your boundaries. Practicing safe sex is crucial no matter your orientation. Using condoms for penetrative and oral sex will help keep you safe from any STDs or infections that you can catch. You can also use gloves or finger cots to protect genitals from any germs on the hands or under the nails, and also keep your hands free from any bodily fluids. A different method for staying safe from any diseases is getting vaccinated. You can get vaccinated for hepatitis A, hepatitis B, and HPV. The vaccine for herpes and HIV is currently still under development, so hopefully we can get those soon as well. I'd also like to add in that if you're using any kind of sex toys, it is extremely important to properly clean them to avoid any bacterial infections or STIs. While some STIs do die once the fluid that they live in dries, others like hepatitis and scabies can live up to weeks or months outside of the body. You can clean your toys by gently hand washing them in warm water and a mild fragrance-free soap. Avoid harsh chemicals as they can cause irritations, and allow the toys to air dry before storing them. This now concludes our sexual health presentation. We hope you are now more informed about your sexual health and know how important it is to make informed decisions. Hopefully you have a better understanding of consent, contraception, safe sex, STDs, reproduction, and orientation. Thank you for your time.